One chance, one life, one take. Little room for mistake. Who do
Hello and
you
welcome
wanna
to the Dead Funny Dead
be?
Series podcast. My name is Mitzi. I'm the host for this series. The series is called 30 End-of-Life Doulas in 30 Days. Today, our end-of-life doula that is joining us is Stacee Ryan. Hi, Stacee.
Hello, thanks for having me.
It's our pleasure. Thanks for joining us. You are joining us from New York. Let's go ahead and dive right in, and you can tell us a little bit about your practice as you're kind of telling us your why you got into this.
I can start off why I got into this. I guess you could say death's been kind of like something that's been kind of in my life since I was young. I had a lot of relatives die around the same time when I was young. I went to my first wake when I was 4. That was pretty memorable. From then on, I've had lots of deaths of friends, family members. I think the most profound death was the death of my sister in 2018. She died tragically. She had taken her own life. So from then on, I was a completely different person. I changed from that day on. It pushed me towards this field I had a feeling I was going to do something with grief, bereavement. I wanted to support other people after that because I know what it's like to maybe not having a lot of support when you're grieving. And since her death, I wanted to do this. I wanted to help others. I wanted to support others. So I started studying thanatology. I started taking classes, learning as much as I could, death companioning. And then I just took the plunge, dove into Anna's program, the International Doula Life Movement. And I just finished last month. I just graduated, and I'm slowly getting my website together, slowly getting into social media and trying to reach people. So that's kind of in a nutshell.
Did you know about end-of-life doulas before you tragically lost your sister?
Not really. I knew of them. I kind of was trying to study grief and what to do about it, how to help yourself, go to groups. I kind of started following Colin Perry. She's a thanatologist. And then I started going, and I believe she's a deathdoula and thanatologist. She's a chaplain. I started studying that sort of stuff. And then I'm like, is that something I could do? Is that something I could get into? It just started calling me. Like maybe a year after my sister's death, it was just tapping me on my shoulder, and I just kept ignoring it. And then COVID hit, and then I was all in. So here I am now.
It's hard when we have those tragic experiences that brings us to this field, but sometimes it's interesting that you say tapping on the shoulder. I feel the same way, and there's some episodes coming up on this series that you're going to hear that because somebody said something lovely. One of the other doulas said something lovely about how that she grew up in the shadow of death. And I was like, that's beautiful, because I always thought it was like death being like, hey, I want you to be comfortable with me. And I was like, nah. And then it was like, no, you really should. And I was like,
I do.
Yeah, I'm not ready yet. And then it was like, no, seriously, you need to be ready. And you're the person that's going to be able to talk about this.
Exactly. And it forced me to be a little bit more open about death. And especially, it's not entirely about the way she died. It's what she left behind. And it's that we loved her very much. And she's still here. I still, you know what I mean? She's still here in my heart. And, she pushes me, it pushes me to try and support people. She was a licensed clinical social worker. So, and I can only imagine, I don't know what was on her plate, but she wanted to help people, and now I want to help people. So
it's really powerful. Thank you for sharing that.
Yeah, definitely.
So that brings us to today, and you are a new graduate.
Yeah.
A program, which is just part of the learning, right?
It's just part of it. Yeah, it's a fraction, but I don't have a whole lot of experience with clients yet, but I have some life experiences that I kind of, my great aunt passed away before I got married, and I visited her in the hospital, and she was comatose, but I had a feeling she could, maybe still hear me. So I would talk to her and sit with her bedside. That was kind of like my first experience. The staff was amazing. I couldn't say enough about them. And that was my first experience. I tried to volunteer for hospice before COVID. I did all the training, and then COVID hit. So I didn't have a chance to do that, but I'm glad that I dove into the training to become an end-of-life doula, because it's a little more in depth, a little more, you're closer to the patients, you're able to do more for them and spend more time with them. So I just took the next step.
And it is a tricky year to just be beginning.
I know, I know. And, with COVID and everything, it's pretty profound in itself. And it just, how can I help more people? How can I contribute to the community and reach out and support people? It's rough. So I just want to be that person. It's just been right now just doing a lot of studying. I am a graduate, so I'm just doing a lot of studying. I'm taking classes. I'm taking more classes. I do have a Reiki 1 and 2 certification, so I can do energy healing with clients as well, if they want that. And the client and their family, I would offer it to them as well. I'm studying Thanabotany with Cole and Perry. That's fascinating. Just learning as much as I can. Education, and talking to people who are experienced and picking their brains and hearing their experiences and advice. I'm just trying to learn as much as I can. And even when I start seeing clients, just keep learning.
There's just so many things. You can study thanatology pieces, you can study grief pieces, you can study energy pieces, and every end of life doula has just a different knowledge base and a different kind of niche. And so I think that that's a really interesting space to be in, especially when you're in the beginning and you haven't been on the ground running yet, which is good. Mm-hmm. Right? Because you're kind of like, okay, I have all this time I'm interested in this and this, and then you get in and you're like, wow, they want something else. And we're just consistently learning, right? Even as a therapist, I did not think that I was going to be a grief therapist. Let's just put that out there. That's not what I thought I was going to do. And here I am. And it's an excellent thing. I absolutely love the work that I do and I love the job, but it just kind of went, I was geriatric mental health. And then for some reason I was just like, the world kept saying, come on over here. It's kind of the tapping on the shoulder with your career as well. Like, what about this training? And you're like,
yeah, exactly. Like, the more trainings that come up, I just want to take them all, but I probably couldn't take them all, but I just want to seek as much knowledge and want to know different facets, be well-rounded, just kind of know about a little bit about this, about this, maybe incorporate some things together. Yeah, I got Reiki before I even wanted to get into this. So now it's like, oh, I can incorporate that. I can help people that are grieving, they're with their loved one during a hard time. And, if I could bring some sort of solace or comfort, I would love to incorporate that into my practice as well.
Love that. And I love that you, real quick, we're going to go into the challenges you found, which we already kind of have a couple of them, right? You got trained as a hospice volunteer and got the rug pulled out from under you, unfortunately, on that. But I'm also kind of interested in the social media piece. Mm-hmm. How do you feel about social media and this work?
It's interesting because, I got my certification. I took the NITA exam and passed, and now it's like, okay, now I'm taking business classes. I've never taken business classes before to kind of help, catapult you into, being open to everybody and letting people know about your services and letting people know what a death doula is. A few challenges, I see all these wonderful doulas. They're nurses and caretakers, and I don't have too much experience, but I'm ready. I'm open to learn. I want to learn. I'm setting up a website right now. It should be done in about 3 weeks, and to get a dabble into social media. I have an Instagram I want to plan on having an Instagram available. Just trying to set everything up, make sure I have things in line and get the practice going, and got to start somewhere. So
You have to start somewhere, and then we're going to get you on YouTube. It will be awesome.
Yeah. Why not? If I can reach more people through social media outlets, then I'm more than happy to do that. Just gonna take one step at a time, seek help, ask questions. I ask a lot of questions, so it's just a learning as you go, and making mental notes and learning from each experience.
And thank you for bringing all of that in. I think it's really important. I do expect many of the folks that are going to be listening to this series are people that are interested, right? Like, what is an end-of-life doula? Yeah. How do I become one, right? I'm really wanting to answer that question. How did you get trained? How did you, what's hard about this work? And I think, thank you for sharing your experience, because you're saying it, right? That it's hard to get in here. There are some people that are nurses or we're hospice social workers. It's very common from what I've seen, and all the doulas that I know know a lot. And they kind of have that one step forward, right? They kind of cut the line, but that doesn't mean that there's just not all this room, right? Everyone's going to die. So mathematically,
yep.
There's a lot of people that need, would like that support. They don't need a death doula, but they could use that support. And I think that there's just all of that learning. It feels like a lot, and it's just one step at a time. So I just want to thank you again for sharing that piece.
Yeah. It's one step at a time. I do have clinical experience. I did work for about 5 years. I worked for a cardiac thoracic surgeon. I worked in an outpatient facility. So I know the patient interaction. It's more of like an outpatient environment, but I do miss, right now I'm doing medical billing from home, but I do miss having that doctor and patient interaction, being there for them. People get nervous, and I do kind of miss that a little bit. I just want that human interaction again, just to like hold space for people, just listen, just be there for them.
I never put that together, that piece where, people get nervous. And what's more nerve-wracking than dying, right? Especially if it's imminent and you know that it's happening. And the people in the room are nervous, the dying are nervous. And what a lovely space to know that you can be comforting there. So what are your hopes, going now into 2021, 2022? What are your hopes for your business?
My hope is, with education and awareness, that death is not a taboo thing to talk about. I feel pretty open about talking about it. Not a lot of people do, but I'm hoping that me coming out with my practice and learn everything that I know, putting it out there, and maybe someone out there be like, it's something I'm interested in. I'd like to talk about it more, or I have a family member that's having a hard time. I want to be able to talk about it. Maybe have like more groups out there for people to openly talk about, their questions, concerns, that type of thing. I just, like you said, it's all going to happen to all of us. It's a guarantee. Someone said once, I saw, we plan for our wedding, we plan for retirement, we plan for babies. Well, how come we don't plan or think about planning for our death? So that always stuck with me. It analyzes kind of what I want to bring out there. It's just out in the open, and it's not, like I said, it's going to happen to everybody. Just want to make it more open to talk about.
I love that theory too, right? When we think about that, we plan for everything else. I mean, we plan so much. I mean, the baby showers and the wedding showers that I've been to, I'm just going to say. And then we're, dying, and there's no hoopla. And I'm just saying that maybe we could have a little hoopla.
It's a hope, and just bringing death care to the hospital environment, and maybe connecting the two, making it more of like a norm in hospitals and other facilities, having death doulas on hand. So that'd be great too.
Yes. I think you're in good company with most of the people on this series with that, making this just really well known and working side by side with the medical field. would be amazing. Let's do it.
Yes.
Tell all your
Yes.
friends, everybody listening to this. Thank you so much, Stacee, for sharing your how, why, your challenges, and your hopes being an end-of-life
Thanks
doula.
for having me.
Oh my gosh, it was a pleasure. And I know that we're all here for you as you're just getting your starts, but this is a great community. So
Yeah. Getting my feet wet.
again, this is Stacee Ryan, Peaceful Passage, End of Life Care, or Peaceful Passage, EOLcare.com. Once Stacee has her Instagram and everything else, we're going to make sure all of that is in the show notes. Follow Stacee, go to her website. Lovely listeners of the podcast, or if you're watching on YouTube, it would mean the world if you subscribed and liked this or shared it or did one of those things or all those things, whatever you got to do. And then follow us on Instagram and be part of the conversation of ethical end of life care. We appreciate you, and we will see you in the next episode.